Again, we'll go ahead and start making our way to our seats, and then we'll get the press conference started here in a moment. I gotta project. Yeah. Check, check, check. Can everyone hear me? All right, we'll go ahead and make our way to our seats and begin the press conference momentarily. All right, everyone can just fill into the chairs. Most of them do not have reserved signs on them, so feel free to just fill in where you can. All right, we'll go ahead and get started.
Thank you.
All right, I'll turn things over to Jennifer.
Hi, good afternoon, everyone. My name is Jennifer McDonald. I'm the Gateway Operations Officer for the Department of Health, Housing, and Homelessness for the City of Albuquerque. Thank you so much for spending your afternoon with us. Today marks a significant milestone for our city. The opening of the Medical Sobering Center at Gateway Center, a key component of the Gateway Network. Thank you to the dignitaries joining us today. Mayor Tim Keller, Representative Melanie Stansberry, representatives from Senator Martin Heinrich's office, reps from Governor Lujan Grisham's office, State Representative-elect Mariana Anaya, Senator Ortiz Epino, representatives from State Achman Vihil's office, Representative Christina Paron, City Councilors Renee Grout, Brooke Bassan, Nicole Rogers, Bernalillo County Manager Cindy Chavez, Deputy Bernalillo County Manager Wayne Lindstrom, Bernalillo County Commissioners Eric Olivas, and our contractor Bradbury Stam Construction, architect Mullen Heller, and our other city leadership. I'd like to turn the time over to Mayor Keller, whose bold vision for this center, he saw a need for a space for people to safely stay, get sober, and connected to resources. This room will be the first step to recovery for countless individuals in our community. Mayor Keller.
Well, this is in so many ways, I think, a sight for sore eyes. For those of us who've been working on this, I think most importantly for those of us who need the services when they see this, it's going to bring hope and it's going to bring healing. And for us, this has been part of a much bigger journey as a city and as a community. And as you see some of the timelines here, and I know I was talking to our counselors and some other folks, you know, first and foremost, we know this has been a little bit of a long time coming. I mean, we acknowledge that. The amazing thing is that this is actually real. I mean, frankly, it is a little bit hard to believe. And it is a moment, though, of gratitude, and it's a moment of hope. I think most importantly, too, it is a moment where we can show to everyone, especially the 50 people who are going to be in here each day in the future, that our city, our community, our state is not giving up on you. And there is a place where you can get help and get off the street and get the kind of treatment that you need, that's open 24/7 and that has no barriers. So I want to walk that back a little bit and explain just for a minute kind of how we got here. And the reason is because this effort has been a long-standing need, right? Our community has known for decades we needed more bed space when it comes to medical sobering. And you can use different terms for that, whether it's detox or whether it's treatment or whether it's addiction. And so we're using medical sobering, but we'll leave it to the experts to sort of parse out how that all works. But the point is a place where you can get help with these issues. And for us as a community, you know we have the wonderful Bernalillo County facility that's been around for a long time. I always forget the new name of it, which I know isn't even new. Commissioner, what is it? The CARES Campus, thank you. We've got the CARES Campus, and then we have lots of nonprofits who do this. But by and large, even when I was first looking at running for the job that the city gave me now, there was always this argument that was basically twofold. It said, number one, there is nowhere to go 24/7 with no barrier in the city of Albuquerque. Now, what that means is like literally on a Saturday afternoon, if you need help, where can you go? Now, there are places, but they have barriers, right? Or the no barrier places aren't open. That's the issue, right? So there are lots of people doing lots of things. But there was no literal gateway into the system. That's what the Gateway Center is all about. It's a place where people can come regardless of their situation, and people can be brought to regardless of their situation. And then they can be sorted out and get the kind of help they need, even if it's off premise at another one facility, even at UNM, UNMH. This is how we want the system to work. It's a continuum of care. It's a spectrum of services. But we know there are missing pieces in that continuum. And so that's why, I was getting out the other day sort of these original ideas when I first took on this job. The number one thing we asked for was to literally build this facility and the facilities around it. It didn't have a name back then. It was just a one-stop, no barriers entry for people who needed help to get off the street or out of a dangerous situation. That was not jail, and that was not the emergency room. So now it comes in different flavors. We have the 24/7 drop-off that we announced and opened and is in use a couple of months ago. But this facility is very, very important because this is where the care actually happens. And this can deal with folks who are at a more acute level than at the CARES campus. And it also supplements what UNM is doing. And so we're going to work with our partners, as we always do, to make sure that we're trying to fill every bed in all our facilities. The question is just sort of how to get people there and how to sort them through the maze of bureaucracy. But that's what we can now do right here. And also I want to mention another gap before I talk about this specific facility was transport. Right? The other question was, how do we transport people Saturday at midnight if it's not to the jail or not to the emergency room? We've solved that too. That's what our ACS, our Community Safety Department, is able to do. So you see us, granted, it took 7 years, but you see us filling these gaps in the system to build something that, frankly, Albuquerque should have always had. And that's what people knew for so long. And I know at points in time there's been questions, costs, all these different things about the gateway and a certain chemical that starts with the letter A that I'm not even going to say that delayed us for a year. But we have persevered also. And we have told this community we are going to get people the help they need. And that is what we are also announcing today. That is what's so important about the future of this very space. Now, this space here, medical sobering, of course, can serve about 50 people at a time. It's going to be open 24 hours a day, conveniently right next to our 24/7 drop-off. It joins the other operating facilities at the Gateway, which is, of course, our large housing navigation center, which if you go out the back door, you can see folks actually enjoying the outdoor space and getting the services that they need there. And, of course, down the road, we have sort of two other components of this that are going to be coming hopefully online next year. So for us, we are finally filling those gaps. We are walking the walk when it comes to what can we do for the people who we see out our driver's window as we drive down our streets, as we walk down our streets to work, as we go to the grocery store. What can we do to actually help these folks? The answer is right here. And I know it's also in many of the other facilities we work with. And that's why we just want to especially thank all our partners. UNMH, Listos, or is it Listo? Listo, okay. Well, I'll get that right. They're new, and they're starting in a couple of weeks. So they're here too, who's going to help operate this facility. And of course, we have had steadfast support from a couple of partners from that vision from day one, from the minute I said, this is what our city needs to do. And now we need it more than ever. That's why this timing, even coming into winter and into the holidays, is so important. These beds will be filled as we go into the holiday season. We're going to open this up and get people the help they need, even during this freezing cold time of year when we need it most. So the city council, in one form or another, has never given up on this project in the end. And so we very much appreciate that, despite all the challenges with construction and things like that. That's critical because we really can't do anything without each other when it comes to the city council and the mayor. And this doesn't happen without both of us making sure that we are prioritizing, no matter what district, no matter what other needs and projects we have, no matter all the fun things we want to work on. It is about what we do for the folks who need it most, for the folks who are least fortunate in this city. That, to me, is the measure of us being good leaders for the city. And this is a great example of that investment. Now, I also want to thank the County Commission. They have been wonderful partners in this as well. And I know our commissioner is here, but in general, even administratively, working through how this fits together with the CARE campus and so forth. The county has been another steadfast supporter. And amazingly, the real juice that helped this go financially came from our federal delegation and from our legislature and our governor. So back when we said, you know what, let's solve these problems, and then we put out the price tag, and it's a big price tag. And we are like, can't do this on our own. We have to do this together. Our representative, our Congresswoman Stansbury stepped up, Senator Lujan, Senator Heinrich. They used their process, the federal government, with earmarks to help out with this. And they did it through thick and thin. In fact, they said the same thing I just said, which is this is literally the biggest need in our community, so absolutely I will help. And so I am grateful for that, and also for the same thing that our governor did. So let's give those partners a round of applause. Okay, so when we came up with this idea, there were lots of things that were happening at the city. And I just want to acknowledge that it might not be necessarily a good thing that this happens to be probably one of the most important facilities that we're opening in this time, in this place. We didn't really see that coming 7 years ago. We just knew we had to fix these structural problems with respect to behavioral health and mental health and unhoused in our city. But now that we are where we're at, this is a massive statement that we are not giving up on Albuquerque. So I also want to just take a moment and ask if she can keep it short, because I gave her a heads up. But I do want to bring up, to me, a very special person, because long ago when we were working on this, there was almost no one who's working on this now was working on it when it started. There are some at the city, and so I appreciate them. But there's also one who's now a state rep, and so I wanted her to be able to share her story. So please bring up Representative Christina Parajon.
Hi everyone, I was the previous Gateway Administrator from this project. My name is Christina Parajon, and I just want to say today when I walked in, I felt really emotional. This project represents hours and hours of work, 60-hour work weeks, where we were really trying to get this over the finish line. I want to shout out to Doug and Charlie, Leon, the people who have been there since inception, Gilbert, who spearheaded this, Ellen, all the people that came together to really work on this, the city employees. I met a woman this summer at O'Neill's who, on Central, she was experiencing homelessness, and in my work, working with people experiencing homelessness. She said, hey, can you help me? And I said, of course. You know, we sat down, we had a sandwich, I connected her to the resources that I know. And she said, you know, I really don't belong on the streets. I belong in a home. And I think that that is really what a lot of the mission of all the team that has poured their heart and the hours of time. It's not just a job, it's also about providing a place of dignity for people. And when I walked through these doors, I saw that people were going to receive dignity here. They will feel belonging when they walk through these doors. We have some of the highest rates of alcohol deaths in the country, the whole country. And today, this is one of 60 facilities across the whole United States. So a huge round of applause, because our state is going to have one of the only sobering centers in the country. First for our state in solving this issue, alcohol deaths in our state. But how many of us know family members, people who have suffered from addiction and who are currently suffering? So thank you to everyone. Thank you to the incredible city team. I'm so grateful to put a little bit of my capital outlay that we get towards this, and hope that we can do even more. Thank you.
The Director of Health, Housing, and Homelessness was an integral part in the planning process from start to finish. I'd now like to turn the time over to Director Gilbert Ramirez to give us the details of the Sobering Center.
Welcome everyone, good afternoon. Again, my name is Gilbert Ramirez. I have the privilege of serving as a Director for Health, Housing, and Homelessness. Prior to that, I sat as the Deputy Director over Behavioral Health. My background as a clinician, I've shared that oftentimes, and this is a project that I felt very proud to be able to spearhead and kind of move forward. But by no means can I say that it wasn't done because the community was screaming, saying we need a medical sobering center in our community. We had a strategic gap analysis done, and I can tell you there's multiples, and each one, there you see, medical sobering center, medical sobering center. We don't have a medical sobering center. So I just feel privileged that, you know, we were able to come together and release a feasibility study that really documented the need and justification for why this facility should exist in our county and our city. That feasibility study really showed, we took a 3-year snapshot of data to look at how many individuals that our fire and rescue and first responders were taking individuals who were intoxicated to the hospital. And we saw over 50,000 patients in a 3-year period that were being diverted to either UNM or Presbyterian. We knew we could do better. And if you look across the nation, yeah, this is an innovation, and it's bold for our state to be able to say, we're gonna put a stake in the ground, and our state now has a medical sobering center. We are part of a national collaborative. There is a movement around this. And when we started this work, much like Rep. Parajon said, there were 40. Now there's 60. And hopefully we'll be that 61st, right, as we open here in a few more weeks. That's the exciting part about this work. But I have to tell you, it was done in collaboration. My team, my hat's off to the folks that bared with me as we were trying to get through this. We did a lot of collaboration with the county. The county and us, believe it or not, we work really well together on a lot of these projects. And one of the identified gaps in the community was this, and we said, we'll take it. And we ran with it. And I went and I pitched a proposal to the BHI, the Behavioral Health Initiative, and I said, we need some funding for this. And I'm very gracious to the county. They gave us $4.35 million to help construct this. Then we turned to our federal delegates, and I'm truly appreciative of that. And we said, we need operational dollars and a little bit more to be able to finish this. And we got a SAMHSA grant and a HRSA grant to be able to complete this project. That and alone shows, when folks are championing an issue as deep as this, that there is an investment to change and do better in our community, and I'm thankful for that. I, again, only was part of the team that got to pick the textiles and the flooring and the furniture, and to see it where it is now. I think the last press conference we had in here, when Secretary Becerra was here, on behalf of SAMHSA and HRSA, and there were wires hanging from this exact same roof. Now, a lot of people do say, and I know the mayor said it's been 7 years, but we acquired this facility in April of 21. And it was a mad dash to get these programs online and out to the community. It took me about a year with my team and others to get the funding together to be able to say, hey, we're ready to go and get this one off the ground. So I want to say that, thanks to our construction company and all of those who stood by our constant adjustment and changes to the facility, and this isn't working right, and then we'd bring another consultant in and they're like, oh, you didn't think of this, and we pivoted. And I'm sure after this is up and running, we'll identify things that we could have done better. But this is a premier facility to be able to address the issues of sobriety in our community. As Rep. Parajon shared, we have to understand our numbers for our state are dismal when it comes to substance use. Alcohol is definitely by far number one, and we're seeing a creep. We see methamphetamines, we see heroin, we see fentanyl. We know what the substances that are in our community are dangerous. I myself was just in the ER less than a month ago for a family situation, and I sat and I listened to the nurses, and they're saying, hey, so-and-so's back. And right as they're saying, they all kind of knew who this individual was. And they were dropped off and they were a chair. And unfortunately, they sat there and then they began to vomit on themselves. They were detoxing, right? They needed a space to sober in a medical facility that's not draining a system that's already overburdened with the amount of medical calls and drop-offs that are happening. So I appreciate it. Chief Jaramillo and I, when we first came on with this administration, we're sitting and plotting and planning. I was like, what are the biggest needs that our first responders need to address? And they said, we need somewhere to take these individuals. It's not the hospital. Because the other alternative is jail. And again, I say we can do better. And this is our attempt to do better, because that is not the solution. Right? So again, I'll talk a little bit about this facility. 50 combinations of either open beds, private rooms, and or recliners. We designed this with the ability to, you'll see everything here is medical grade beds, furniture, mattresses, all with the design. If you tried to flip one over, you'll notice there's some weight to that. It's all a safety issue, right? So we were very intentional as to the design of this. The colors, trauma-informed, designed to be able to be warm, peaceful. The lights can be adjusted as individuals are in here sleeping. We know we need private rooms, because if you've ever worked with this population, you know at times they can snore and be very loud and annoy other individuals. So we have private rooms, all with the ability to really serve who we are. You'll see that it's split in two areas, very intentional. We know that if you're serving someone under the influence of a depressant, that's a lot different than serving someone under the influence of a stimulant, right? You may need separation of what your space looks like to be able to serve them better. We also knew we might need gender separation, right? So we were very thoughtful around what this facility could do. More importantly, the tail end, when you leave. Peer support rooms, access to harm reduction medications that you're going to need on your way out. You can wash your clothing that may not be the best condition as you leave, but you're going to leave with your stuff laundered, smelling good, and ready to go back. More importantly, we hope we'll be able to connect you to a service long-term. We've been working with the county for those transitions to the care campus, and they've expanded services there. In this facility alone, we have Turquoise Lodge, which is a detox facility. We have other inpatient partners who are also here. And we just recently signed a lease with a partner who is going to be able to provide Medicaid-assisted treatment for individuals. The goal here, as you saw in those colored lines, is can we walk you down the hall, not send you across town? And can we do that now, not in a month? That is crucial for individuals, because the window of opportunity for change is about this big before someone says, never mind, I'm leaving. And we also understand that individuals may choose to say, not at this time. My story, my trauma, my issues are too heavy for me right now, and I'm not in that space. But maybe on that 10th time, that 15th time, that 20th time, something clicks and changes and says we're ready to connect to the next level of service. And we want to be ready for that. And we want to be able to respond to that. So the intentional design behind this facility is huge. Now I'm going to close with something, because it's a push and I know my audience. Folks, How we pay to maintain this facility annually is going to be a challenge. I have a SAMHSA grant, and that's going to take us quite a bit. City Council has granted us some operational dollars, but there's still some advocacy that has to be done at the state level. Our Medicaid waiver could allow for this to be a reimbursable service for our state. We need champions at the state level to say, let's push, let's make this available. Why? Because nothing that I do here in Albuquerque is just for Albuquerque. I always think of our entire state. I'm a longtime resident with children here, my family is here. We can have med sobering centers throughout our state knowing the statistics of how bad things are here. But one, how are you gonna build them? And we are pretty rich in capital dollars these days. Two, how are you gonna operate them? We need a sustainable model and a change to our Medicaid waiver to be able to say we can now build this and reimburse it and it can self-sustain. Why? Because our community deserves that. If not, you will pay it on the back end through expensive visits to the emergency room, through expensive call-outs to our first responders, and through expensive call-outs, sadly, and I hope this is not the case, to incarceration and individuals in that system. Again, I say, we can do better. So that's how I will close this, because our work here is not done. We will open, we will start serving, but the next level of policy advocacy we have to do is find a sustainable model to be able to fund sobering centers in our state, and then build more so that every county can do that. They don't have to come here. They can stay in their own community, get that service and treatment. And more importantly, this is a harm reduction model. We save lives. And I will end by just saying, you can't put a value on that life, so it's worth the investment. Thank you all for being here today.
This project wouldn't have been possible without our federal funding partners. We have the pleasure of being joined by Representative Stansbury today. Thank you for your support. Come on up.
All right, well, good afternoon, everyone.
Good afternoon.
All right, I love to hear that. I am Melanie Stansbury, and I am deeply proud to represent New Mexico's 1st Congressional District, which is right here in the heart of Albuquerque. And I am so deeply proud and thankful to be a partner in helping to support this facility. Now, I think it's appropriate that this facility is being christened on Thanksgiving week. And I want to start by saying how thankful I am to all of you who had the vision for making this center a reality, to all of our caregivers, to all of our medical providers, to all of those who work in recovery, who work in 12-step, who work in helping our people who are struggling with addiction. Thank you for believing in our people. Thank you for continuing to keep the faith and know that we have to invest in them and their well-being and their path to recovery. Thank you to the mayor and to our city council, to our county commissioner, to everyone who invested in this program and this project, and to our state legislature. This project represents the best of New Mexico. While there has been a delay, obviously, because of the facilities needs around this specific facility, this is exactly what our state needs to address the addiction crisis in New Mexico. Now, I want to say that on a personal note, all of us here in New Mexico know that our families and our communities are hurting. And for me, this facility in particular ties to a personal story that I have not often shared in a public setting, but I think really illustrates the necessity to have programs and services like this. A number of years ago, I had a family member who was struggling with alcoholism, and it was shortly after the state behavioral health system had completely collapsed. Our family member was struggling to get back off his feet. He had been sober for over a decade, but fallen off the bandwagon. And when he started drinking again, he could not find a facility that he could afford to check himself into. And so he was staying in a place where he could do what he was doing. And he got picked up by local police one day and taken to a local detention center. He died in a cold jail cell because there was no place for him to get sober. And he had a medical emergency in that jail cell because there was no one there to help him. He would be alive today if he had had access to a facility like this. All of us have a family member or multiple family members in New Mexico who are struggling with addiction, whether it's alcoholism, whether it's drug addiction, whether it's some combination of all of the above. And what I can tell you is that this center will save lives. It will save lives not only for the people who are able to come here to get the care of trained medical professionals who know how to help people who are trying to get sober and to get back on their feet, but it will also save lives because it will open emergency room and hospital beds so that people who are struggling with other forms of emergencies can actually get admitted into the hospital in a timely manner. We not only need this facility, but we need many, many, many more of them. And that's why I am so deeply proud to help be a partner in funding this program alongside Senator Heinrich and Senator Lujan. It's why my office has invested millions of dollars in behavioral health. It's why we're helping to fund new clinics through First Nations here in the International District, why we're helping to fund a Veterans Integration Center just down the street, which just opened, and countless other programs. This is just the tip of the iceberg. There are literally tens of thousands of New Mexicans who are struggling with addiction, who are struggling to find a way back onto their feet, who are struggling to find a way back into housing. And this is one of the vital programs that will provide a pathway for our people to get into recovery and back into wellness and to save their lives. So I want to say thank you once again. I'm so deeply proud to have worked with my colleagues to have helped secure $2.2 million to help support this program. We know that addiction does not know address, does not know race, does not know economic status, does not know gender. Addiction strikes every single family, and we know that we have to work every single day to address these issues. In Congress, I'm a proud member of the bipartisan crisis and have been working to introduce legislation and secure millions of dollars to bring home and across the nation for drug interdiction, to help support our law enforcement as they are helping to get drugs off the streets, and for behavioral health and medical programs like this that will help our people get better. As has been said, this program will provide 50 beds 365 days a year. That's 50 people every day in our communities who will have the opportunity to be safe and on a pathway to recovery. So I say thank you once again. I am thankful for you all. Happy Thanksgiving weekend, and what a beautiful way to celebrate the beginning of this week in which we think about the people we hold most dear and the ways in which we are going to support them. So thank you.
Senator Martin Heinrich has also been a crucial partner for us in this project. To say a few words on his behalf is Deputy Chief of Staff Edward Tabet Cabrera.
Good afternoon, everybody. First, I just really want to thank the Congresswoman for having the courage to share a story from your own family. Because this is not just about the stranger, right? This impacts so many of us in our own families. Last year, I lost 2 first cousins and an uncle to overdose, and they need this place. And in our families, as educated as we are, and like, there are problems that our relatives face that we don't know how to address. Like, we don't know what to do. We don't know who to turn to. And the only way to really educate ourselves on that is by sharing our stories, is by normalizing this conversation from one person to another so that we can figure this out. That's why this is such an important issue for Senator Heinrich. From the first day that Gilbert called and walked the senator and our team through this vision. The last time the senator was here, it was now Representative Parajon in a hard hat and an empty shell, the wires hanging down, and to see this vision come to reality to help families like ours and to help the stranger at the same time is such a big deal. So on behalf of the senator, I'll share his remarks here. Mayor Keller, Gilbert Ramirez, and the entire team, congratulations on this major milestone, not only in the build out of the Gateway Center, but in helping lead the rebuilding of the behavioral health care ecosystem in New Mexico. I was proud, alongside Congresswoman Stansberry, to contribute $4.2 million in federal funding to the construction and operation of this facility. I toured the future site of the Sobering Center in the winter of 2022 when it was still an empty shell of an old hospital. I know the team took tremendous care to create the beautiful, functional, trauma-informed space we see today. To Listo Health, welcome to New Mexico. Addressing our state's biggest challenge takes innovation, and as the first medical sobering center in New Mexico and one of only 60 in the country, this service will break new ground in the way that our first responders and hospital systems can provide care to people struggling with substance use. Even the most conservative estimates show that this medical sobering center will provide appropriate low-level medical care, peer support, and referrals for long-term care to thousands of New Mexicans. Thousands of people who won't be in our emergency rooms, thousands of calls that first responders can complete without a hospital intake, which gets them back in service faster. I will continue to fight to bring the tools and resources so that our providers on the ground have what they need to do their work. Alongside all of you, I look forward to seeing this center open, serving patients, and making a difference for New Mexicans for years to come. U.S. Senator Martin Heinrich.
As we open the center, a majority of our clients will be referred by Albuquerque Fire and Rescue and Bernalillo County Fire. To talk about the importance of this partnership is Chief Emily Armio.
Yeah, Chief.
Hi, everyone. I want to echo what Christina said. I'm so excited to see this facility today. And I want to talk, I've been a firefighter paramedic for almost 20 years and working in this system only. And I also worked at UNM in the ER for a period of years. And so I've seen both sides of our system and how we really are not providing the right resource to people that are suffering from addiction and needing detox. And I want to talk about our partnership with Gilbert and his team because it's really meaningful to our department. As the fire department, we oversee EMS for the City of Albuquerque. We work with Bernalillo County Fire, and then also Albuquerque ambulances will be transporting here as well. And a lot of these ideas come up, and people come together and they come up with these great ideas, and then they forget that EMS is the transporting agency. And they construct these great facilities, or they come up with these great teams to respond, and then they realize, well, wait a minute, these clients actually are not really stable to just go to this service. And we have not had a place in my 20 years of working here where we've been able to take somebody that is detoxing anywhere except for the emergency room. They could have high blood pressure. They could be taking one medication. That means that they can't go to a facility, and we have to take them to the emergency room. And with my emergency room hat on, what would happen is I was the paramedic in the emergency room. I would triage that person, and I would take them to a seat in the waiting room, and they would detox. And this is what's happening now. People are detoxing in waiting rooms, and we know that this can be life-threatening. They need medical monitoring, they need treatment, they need medications to get through that period of time. It's no wonder that we have issues with people not seeking out recovery, because that doesn't sound like some place I would want to go if I was trying to recover from addiction. So we're very excited, and I want to just also touch on, I see Ellen, Gilbert, Doug. I started with this administration as a deputy chief over EMS in 2018, and when they had this idea, AFR was part of the planning process from the very beginning. Our medical director, who is also an ER doctor at UNM, was part of the planning process. This is the first time that I feel like I've been a part of something that was a true collaboration. And so on behalf of all of the EMS agencies in the area, county, fire, Albuquerque ambulance, and AFR, we just want to thank Gilbert and his team for allowing us to be part of the planning process so that we could really take these clients that we call them patients, but we respond to them every day. They might have 5 different bands on their wrist from all the different ERs that they've seen over that week, and then we might not see them for a week, and usually that meant they went to jail, or sometimes we wouldn't see them again, and then we didn't know what happened to them. We're really excited to have a place that we can take people that will relieve the demands on the ER so that we can get our more critical patients in and processed at the ER faster. We just appreciate it very much that we got to be a part of that planning process. And then my last piece of this is an investment in public safety. I think that we talk about, like, we're a busy fire department, and we always have to take on more expensive resources to deal with the demands in the city. What we would love to see is our call volume go down because people are able to access the services that they need to get healthy and better and into housing and not need to go into an ER. So this is an investment in public safety. We appreciate everybody for helping fund this. This is transformational for our EMS system in the city, so we're very excited and just want to again echo from everyone how thankful we are that we were able to be a part of the planning process. Very excited about this, so thank you.
Now to talk about our partnership with Bernalillo County is Dr. Wayne Lindstrom.
Thank you, Jennifer. Good afternoon. Cindy Chavez is our new county manager, and she asked me to express her regrets, but due to other commitments, she was unable to join us today. I am the Deputy County Manager for Behavioral Health, which is a new position because the County Commission decided that it was time to elevate behavioral health within the structure of county government and passed an ordinance that really paved the way for us going forward in building a more robust continuum of care in partnership with all of you. I too, like the representative, was thinking about Thanksgiving this week, and I'm an old guy. I've been around the country a few times. My home state is Ohio, which just happens to be the birthplace of Alcoholics Anonymous. And I was in charge of addiction services for the state of Ohio back in the 80s when Alcoholics Anonymous was celebrating its 50th anniversary. Under the governor's leadership at that time, we had a 3-day conference and celebration in Akron, Ohio, to commemorate the achievements internationally with regards to Alcoholics Anonymous and really all the spin-offs that followed AA's leads. And one of the keynote speakers that we were fortunate to garner at that conference was Susan Smith Windows. And Susan Smith Windows was Dr. Bob Smith's daughter. And AA was founded by Bill Wilson, who was a stockbroker from New York City. And Dr. Bob was a physician really committed to individuals at that time suffering from alcoholism. And she proceeded to share that as a little girl, she hated coming home. And the reason was because Dr. Bob would use formaldehyde. If you remember your biology class and had to do anatomy and pull rats and frogs out of barrels of formaldehyde, you know what that smells like. Her house always smelled like that because he used formaldehyde to detox the inebriated individuals he'd bring to his home. And if you're ever in Akron, Ohio, that house today is a museum in honor of Alcoholics Anonymous and Dr. Bob and all the folks that have recovered as a result of that early pioneering effort. And I'm also reminded, in fact, Senator Pizzottini and I were talking earlier today about the beginnings of Alcoholics Anonymous, and it actually was an outgrowth of a phenomenon we had in this country at that time known as the Oxford Group. And a lot of AA principles really grew out of that history. And Dr. Bob and Bill met at Mrs. Seiberling's house, and that mansion is still in Akron, Ohio today. And their meeting with the Oxford Group is where they thought up this idea of Alcoholics Anonymous, because they found the only way they were able to stay sober is by talking and supporting each other. And it was out of that simplistic discovery, if you will, that AA grew. So, you know, a lot of times we get frustrated by the lack of resources that we have, and we get burned out, and we wish we could realize bigger visions, etc. This is, in fact, a realization of one of those visions. And this is a long way from the 1930s and having to use formaldehyde to detox individuals. The other thing, though, I'd like to leave you with is that my mother was a single mom. She was a high school dropout. She waited tables to make a living. She had me when she was 19. My dad split when I was 2. And at 9 years old, when I was 9 years old, she remarried. And she married a man who was himself suffering from what we call today alcohol use disorder. And she became pregnant. On the night of her baby shower, he brutally beat her. I didn't see her till the next morning, and I didn't recognize my own mother. Her eyes were swelled shut. Her lips were 3 times their normal size. Her head was just all black and blue. And I'm convinced that ultimately what he wanted to do was to abort the child, you know, that she was carrying. And so as we go down this road and have other visions, I want us to remember it isn't always about the person who has a substance use disorder. It's the others that are left in the wake of that addictive behavior. And we've got a lot more work to do when it comes to dealing with family members who suffer the traumas of living that addictive path as well. So thank you for this, Gilbert. You've been a great partner, and I look forward to us continuing the good fight. So thank you.
We know that meeting people where they're at means providing access to peer support with lived experience. ACS peer support worker Denise Thomas joins us to talk about the impact this will have on those who live here.
Hi, I'm one of the lucky ones. My name is Denise Thomas, and I work with Albuquerque Community Safety, opioids education and prevention. But it took me a lot to get here. After being raised in a family where my mother struggled with her addiction and my father sold drugs, I used to tell myself I never wanted to be like either one of them, and I turned out like both of them. Not only did I struggle with addiction, I ended up doing 17 years of my life in prison, and my mother was left to raise my kids, which, through the grace of God, got her out of her addiction. I should have been there for my kids. It was hard. When you're in addiction, you make a lot of wrong decisions, and I did just that. I made so many wrong decisions. I left when my sons needed me the most. Lost a grandson of mine, and I couldn't handle it. I left when my son needed me the most. And completely different person. And that was through me working with ACS. I'm able to get out there and help people. If there had been a medical sobering center when I was struggling with my addiction, I believe it could have saved my life. It could have gave me that space and that support that I needed without judgment. I wouldn't have had to spend 17 years of my life without my sons if I would have been able to come to a place like this, and they could have helped me, because I had burned every bridge already. So when you are at that point and there's no place like this to go to, you have nowhere to turn, and that was over 20 years ago when we didn't have this. But through the grace of God, we have it today, right, to help everybody else out there still struggling with their addiction. So I knew if it would have set me on the right path to recovery, I know that for sure. No one should have to fight their addiction by themselves. They should be able to have those resources that they need in place to take them wherever they need to go today. And especially with no judgment, it makes it so much easier for somebody to want to come in and get that help. Because we were always afraid 20 years ago of what people would think of us. It was a lot different back then. But with a lot of hard work and dedication, I'm able to be the grandmother today that I have grandchildren that I'm raising today, my granddaughter. I'm also able to help the community and to give back what I stole from the community all those years of selling drugs and being in my addiction. I'm able to give back today. I'm able to meet people where they're at through the grace of God.
Denise. Thank you for sharing your story. Thank you for serving ACS and being a strong partner with us. That about wraps it up. I just want to give one more shout out to Bradbury and Stam and Mullen and Heller. They were such amazing partners. They were dream partners. They showed up. They wanted to solve this problem with us as a community, so I want to shout out to them. I also want to say welcome to Albuquerque to Alex McCabe, who's the president of Listo, who's going to be an operator for this site. He is so invested in making this a success that he has committed to moving to Albuquerque and living here for a minimum of 6 months. I think we're going to sway him with our green chili and our hot air balloons and our amazing community and weather. So we may make him a permanent resident. Thank you all for joining us, being supportive of this project. We're going to do tours. If you didn't get a tour, please stick around and we'll be happy to show you around. Thank you.
Tell them there's cake.
Oh, there was also cake. Please eat the cake.